Hi, everyone. I'm Dr. Kristen Rojas, a breast cancer surgeon and board certified gynecologist. And I'm here today with the Real Women's Health podcast / Zoom meeting with my new colleague, Hilda Villanueva. Hilda, welcome to the show.
Thank you for having me.
Sure. I'm so happy to have you here. Hilda is a doula, which we're going to explain what that is. She's a doula in her community, and she's working with an organization called AMAR, or Apoyando Madres y Armando Redes, which means, yeah, I got it, which means supporting mothers and creating networks. And so today, she's going to tell us all about what it's like, her role as a doula, how doulas can help improve maternal outcomes, specifically in Hispanic populations, and maybe how that's been related to what's going on with the pandemic. And so I'm so thankful to have you today. Thank you for your time.
Thank you. I'm happy to be here.
Great. Hilda, why don't we start? Why don't you explain to our listeners about what is a doula and what do you do and maybe how you ended up in this role?
Okay. Well, a doula is a trained professional that, gives support to mothers, and their families during, their pregnancy, labor and delivery, and also postpartum period. Also, what they do is, we also take resources out, bring resources out from our community and try to connect them with the needs of the family.
So do you go with women when they're pregnant to their prenatal visits?
Yes, we do. And the only different now with the pandemic is now, they don't allow anybody to go to their prenatal, like with their visits. So they will have to go by themselves. But we try to either do a virtual, either before or after, or to check on how the visit went, or if they needed any information, if they talk about something that they didn't understood, and we could get them that resource, or information to them.
Yeah, I imagine. And then on when the patient comes in labor, pre-pandemic, I know that your role was to, especially women that don't have anyone with them, because sometimes the labor course can be days. And especially if women don't speak English, it can be very confusing, all these challenging decisions that have to be made. And there's an issue not only with health literacy, but a language barrier. So you also go with women who, for extra support during the labor process as well?
Yes, and starting in July, if I'm not mistaken, I think it was July, where the governor of New Jersey signed a petition,
Law or
that is
proposition?
that doulas can go in with one support person, but we will be part of the support staff instead of being just before they would not allow us to go into the
Do you mean in the setting of the pandemic, or
yes,
or outside of the pandemic?
with inside when we were going through the whole pandemic.
Mm-hmm. And then do you also help women who are maybe having challenges with breastfeeding after delivery as well? Or
Yes, we do. Yes, we do. And we connect them to the WIC program, where they have lactation consultants. We also have one of our doulas is La Leche League in Spanish. So she gives us extra support to our moms if we need it. If I have a mom that is in really need and I need that support from, my colleague, I will just call her and she will be, helping with the mom as well.
Yeah, it sounds like you're kind of a connector of different resources, which for a lot of women, they may not even know these resources are available, right?
Exactly.
So maybe how did you decide to become a doula? Can I ask you that?
Sure. I think I have a love and a passion to help my community and help others. I came here to United States when I was 17 years old, and I feel that language and social barriers were a big thing for me. And being, able to share that with all the moms, it helped me, and it helps them to trust me, to, you know, rely on me, and say, okay, she's been through it, so, you know, we have something in common. And the doula, community doula training came along, and I was like, sure, I want to do that. I want to be able to help, you know, the moms more one-on-one, and be, you know, so that's why I decided to become a doula.
And how long have you been a doula?
For a year.
Oh, okay, amazing.
Yes, November, it will be a year.
Oh, you're almost to your anniversary.
Yes.
Basically.
Yeah.
Well, maybe you could explain for some of our audience what specific challenges Hispanic women have during pregnancy and around the time of delivery, and how maybe COVID or the pandemic has completely made those effects even worse. Could you explain some of that for us?
Sure. I think one of the biggest challenges that the moms, you know, have had during the pandemic is food insecurities, also language barrier when they go into their appointments or when they go into labor. So those are one of the biggest, you know, challenges that I see, in isolation as well.
Mm. Definitely. Yeah. I remember during my obstetrics and gynecology training at Brown, we had a large Hispanic population, and I always gravitated towards those patients because I speak Spanish. And I was always profoundly impacted when I saw specifically a young Hispanic woman that didn't speak English, who maybe is alone, who comes in labor. And I remember I always tried to explain everything to her, but as the obstetrician, you know, we're managing multiple patients on the labor floor, in and out of the operating room. So having another person there that could kind of help explain some of the decision making and support moms through that. I can't tell you how many times I wish that I had a patient that I wish someone else was with her. And so that sounds like a great resource.
Yeah, I think that's the good. We work with a prenatal health clinic here in the city, and the majority of them are midwives, and we can notice they really are welcoming to, you know, to us doulas in the laboring room, just because they feel, you know, that their patients are taken care of and supportive while they are running to other, you know,
Mm-hmm.
women's in labor. So that makes us feel as well, like when we feel welcome and we know we appreciate it in that room, is what, you know, we look for, and to be able to have a healthy birth with, you know, our family. So
Yeah, I feel like everyone has the same goal, you know, it's to make sure a mom understands what's going on, and then there's any big decisions that need to be made, she understands, and then kind of navigating, you know, the delivery, which, you know, having a baby is not like the movies. It is a long process.
I
It is,
know.
yeah, women can be in labor for like a day, and then all of a sudden we have to pull the plug and say, you know, this is an emergency. We need to do something else quickly.
Mm-hmm.
And I feel like, you know, women sometimes aren't allowed to eat while they're on the labor floor. So we'll have them on the labor floor and they can only have like Jello and water, and they're
Mm-hmm.
hungry, they're tired, they're exhausted. And it's like, it is not easy to be a woman in labor, especially if, getting ready for a planned C-section or recovery. It's challenging. Yep.
Absolutely, it is. Yeah.
So I was reading, I do know that, you know, United States, even though we have a lot of resources, we're not doing very well with regards to maternal mortality. Like, our rate of maternal mortality, meaning women that die around the time of delivery, has tripled over the last, or doubled over the last 30 years. And they're saying that like half of those deaths are preventable. Do you think that by intervening in these women's pregnancies early, you can help, you know, mitigate some of those risks that women may face at the time of delivery? Like, do you help women who maybe have high blood pressure during pregnancy or have diabetes during pregnancy as well? Because we know those can make worse outcomes.
Absolutely. You know, the good thing about being a community doula is that you have a contact with these families from early pregnancy. So what we do is just we take educational material to them. Like if mom tells me, you know, I've been diagnosed with, you know, gestational diabetes, we get them information, flyers, you know, in their language so they can feel, you know, comfortable and learn about, educate them so they can feel empowered. When they go in there, they know exactly what they're doing, what are, you know, what's going on, you know, and understanding what they need to do to control either the diabetes or, you know, so I think the benefit of, you know, having us there, you know, during the prenatal period and going in and giving them, you know, educational material and asking their questions. And if we don't have the answer, we always tell them, you know, you ask your provider, make sure you put a list in a paper, because everything, we forget everything before, you know, we think about it. I tell them, think about it, write it in a piece of paper. So when you go and see your provider, you can ask those questions and share them with me so I can, you know, have a better, you know, we both, you know more about it. And if they don't, we do research. We try to, you know, ask also, you know, get information for them. So those are the good things, that we are there with them during that prenatal period.
Yeah, that's really great advice. I'm always telling my breast cancer patients, like, I meet them and I have to give them all of this information in like 20 minutes. And I'm like, you're going to go home and you're going to think of more questions.
Mm-hmm.
Write them all down. And when you come in for your next visit, we'll go through them. And bringing a piece of paper, because even when I go to the doctor, I have to make a list saying like, all the things I need to talk to them about, and like prescriptions I need or questions I have. So that's really good advice.
I think we all do have to write them down.
I know, because when you finally get your like 15 minutes with the doctor, even me being a surgeon, I'm like, wait, I have like one more thing.
I forgot. I totally forgot to ask you this. Or we walk out of the office when we thought about what we were, you know, supposed to be asking, and go, now I remember. So I tell them always to write them down and have a list. And, you know, if they cannot ask all the question in that visit, you know, ask the most important or the most, you know, that they can, they would like an answer, and then save the other ones for your next visit. And
I know that one of your the goals of a doula is also to help minimize unnecessary C-sections. Would you say that that's an important aspect of your care as well?
absolutely. And what we do, we take, you know, that educational material as well. How can, you know, we also tell them how cesarean sections, you know, can be a life-saving, you know, for mother and baby when they're at risk.
Mm-hmm.
But if we can, you know, prevent having one, you know, it is we as doula try to help our clients prevent, you know, the cesarean with our continued support, you know, trying to help them feel confident in their, you know, bodies, trying to help them to be patient and give, you know, the process some time.
Yeah.
And also we educate them and on the risk of having a C-section.
Yeah, a lot of women don't realize, because it's the most commonly performed surgery in the United States. Oh, just having a C-section, no big deal. It is a very big surgery. It means a longer recovery for you. It means you're going to have to be in the hospital longer. And usually, you know, if a woman's in labor for a very long time and then there's an emergency where we have to have a C-section, that can further increase the risks of the surgery because of how the anatomy and the timing and everything changes. So I know there's a big push among obstetricians now to minimize unnecessary C-sections. There's been like big consensus guidelines about this too. Women don't realize, but so if you have one C-section, you know, we've always thought that you need to have a C-section after every, you know, if you have one, the rest of your babies need to be C-sections. That's not necessarily true, right?
No, and no, not necessarily.
Yeah.
You could have, you know, you could have a first C-section, and then the other one, it could have been, you know, an emergency, like you said, or, you know, the baby wasn't in the right position, or, you know, and then in the next one, they feel like they should not try just because they have, you know, their first. And that's what we also tell our moms, that doesn't matter. They can try if you're, to have a natural birth after a
Yeah,
C-section. And a
definitely.
lot of women
Mhm.
have a, natural birth after a C-section.
Yeah, we like for them to be, at least 2 years out, and for the C-section to be a certain way. And there's a couple of different requirements that we have. Another one is making sure there's anesthesia around in case there's an emergency. But yeah, we call these VBACs, or vaginal births after delivery, or trial of labor after cesarean, or TOLACs. And so there's a big push now to educate women that that can maybe be a possibility for them under the right circumstances. Yeah.
Yes.
Yeah, and doing that is huge because women don't realize, but every C-section that you have after the first one, there's more risks of injuring your bowel or your bladder or injury to the baby. It just becomes more and more complicated. And so if women have extra support like you guys to help them get through the process of vaginal delivery, which can be very challenging, then that's great.
Yeah, absolutely. We try to tell our moms, um, let your body tells you, and if your doctor and your provider tells you that it's okay to have a vaginal birth, after that C-section, having all the requirements, like you said, your medical records, and have everything, that they need to know to be able to tell you you can have a vaginal delivery. So what we tell our moms is just trust your body. You will, make sure that you focus on don't think about C-section, just worry about, like, if this is your first, birth, and think about having your baby naturally. And
Yeah.
so, and also the educational piece of taking the materials, they talk about that and in their language. So it helps, big, tremendously.
Well, I know that you guys have been working specifically with women who have been impacted by coronavirus or the pandemic. How are Hispanic women more impacted, and what kind of special needs do they have? Because we've read that there are some populations that just do worse, but I can't even imagine being pregnant with COVID right now.
Well, like I said before, our families, the families that we serve are, their immigration status is, they either don't have the right, documentation, and they cannot get any benefits, like financial benefits. So they are, forced to go out and work. So they are more exposed. They also multiple families live in one house, which they are more, at risk to be exposed and have the virus. So we have had and been in labor with some of our COVID patients, and it's tough. It's hard, it's hard for mom. It's hard, for us. Is just, we are blessed to be able to be there with them and be that support, at least during that time.
Gosh, you guys, so doulas are really also the first frontline workers even during delivery. Yeah, I didn't even think about that before, but yeah, I can't even imagine how scary that must be, especially if you didn't speak the language.
Absolutely. And because of, the partners will not be allowed to go into the room just because of the being positive as well.
Mhm.
The only resource and the only support person is us, the doula. So, but we are happy and able that everything, it was a healthy outcome. Mom is healthy now, baby's healthy.
Mhm.
Mommy was able to breastfeed baby right there and then. It was no separation. So those are the what we want as doulas, that,
Yeah.
mom has a great outcome.
So speaking of breastfeeding, if a woman is positive for coronavirus, is she able to breastfeed right after delivery?
Absolutely, she
That's
is.
good information. I'm glad you told me that so we could spread the word. Yeah.
Yes, yes. We don't want, you know, the baby to be separated, and it's no research, no tests, research that shows that breast milk, having the virus will affect the baby. So that's why we encourage moms to breastfeed and pass all those antibodies to that baby.
Yes. Good antibodies probably end up being helpful, especially in today's world when everyone is exposed to so many things. Yeah.
Yes.
So after delivery, when I was a resident, we always struggled with losing patients for their postpartum. Like they would never come back for their postpartum visits. And that visit was so important because we wanted to talk to them about planning their next pregnancy and making sure they have enough time between this baby and the next baby, whether it's with contraception or, helping them understand how quickly you can become pregnant again after having a baby. A lot of women think if you're breastfeeding, that you can't get pregnant, but we always try to get them in. Do you do a lot of postpartum education as well with those women?
Absolutely. We do at least 4 visits prenatal, labor, supporting labor and delivery, and also do at least 4 visits after postpartum. We do more than 4, just, that's the minimum. But we take the time even before mom delivering the baby. We take them, we have a piece of our educational component is just taking material on contraceptives. What are you planning to do? Do you need more information on certain things that you would like to have, either pills, Depo, or Provera, or IUD. So we give them that information that they need, and they're ready after they deliver their baby. They already have in their mind what exactly they would like to do. Yeah. And so I think, like I said before, the benefit of having us and taking that educational material to them, it helps them also educate them, and they feel empowered. They feel like they can, they know exactly what they want and the decision after giving birth. So
yeah. And tell me if this is like this in New Jersey, but in Rhode Island, women, if they didn't have commercial insurance, so if they were on Medicaid, they had to decide if they wanted to have a tubal ligation and sign the forms for this more than 30 days before they come into the hospital. And that was really a challenge because a lot of women have decided that they're done having children, and we have the opportunity to tie their tubes during the same admission, and they get there and we're like, we can't, we're bound by the government. We cannot tie your tubes because we didn't have this conversation more than 30 days ago. And so is that the same in New Jersey?
It's the same thing here in New Jersey as well. And what we do, and like going back to, the importance of taking that material and time. So mom have the time to also ask, can I want to have a tubal ligation? Can I sign I know I have to sign my papers before then because, my doula told me, or, she gave me an information and it says here that, we need to be able to make, a decision before then. So, yes, here as well, they require, time to sign those papers.
Yeah, that's one of those policies where the intention was probably good when it was designed, to keep women from having to maybe being taken advantage of or getting a tubal ligation when they don't want one. Like the idea was probably good back then, but now it really does end up being sometimes a really big obstacle. So it's good that patients already know about that ahead of time, because a lot of times they don't. And it's nothing sadder than having a patient want have her tubes tied and then not be able to do it. And then she's pregnant in 6 months and it's like, oh, that was always so heartbreaking. It's like,
yes, prior to, becoming a doula, I did work in a prenatal health clinic. And those were the challenges, not have the moms, were not informed or didn't have the right information, or they did give them the information because of the language barrier, it was missed in the whole, visit. And yes, they received the information, but they didn't understood. So a lot of moms will come in and they will be like, oh, I really wanted to have a tubal ligation and I wasn't able. But yeah, those are a good thing to have a educational before, while you're pregnant, have all those, visits with the moms.
So could a woman who speaks, we're talking about specific to Hispanic women, but women who speak English who also want a doula can have one also. It's not just for Hispanic women, right?
Yes, our program target the Hispanic population, but we also have within the city, they have other programs where they provide doulas, community doulas for African Americans as well, or English speaking moms. So.
That's great. And then, so what if one of our listeners is pregnant and she's like, you know what, I think I need a doula and I want to look into that. What resources, maybe do you have a website or something we can tell them about for if they're not in New Jersey?
No, absolutely. They can go into the Children's Home Society of New Jersey and look up all the programs under maternal and child health, and they will find our program doulas, Amar Community Doulas, and they can just fill our referral. From there, we have an automatically referral where they can put their information in there, and it will go directly to our supervisor, and she will do, call the mom, try to, get more questions, do an intake, and assign her to a doula.
Perfect. And then if they're living outside of New Jersey, is there, how should they go about finding a local doula there? Do you know?
They can do a research on the, I know we have, in South Jersey, they have a doula program, Northern Jersey as well. But if anything, if they only want information, they can always put it in our comments, and we will be glad to give that resource to them as well. So
great. And I'll also look up some websites and include them in this post for any women who are thinking about that.
Great. Great.
I also wanted to point out before we wrap up that you can decide that you want to be taken care of by a midwife or an obstetrician. And sometimes, it's something to talk about with your doctor, but just because you decide to go to an obstetrician, or maybe you have a higher risk pregnancy and you need to be seen by maternal fetal medicine, that doesn't necessarily mean that you can't also have doula support. Just talk to your doctor, and then they could probably find doulas willing to work with them, right?
Absolutely. A doula is just a support person, for you and your family. It will not take, any, we work with, our obstetricians plus midwives, and it just, we are there for you and your family to give you that support. So
Great.
It doesn't really matter. You can always have a doula in that birth room.
And is it covered by insurance if it's not within your program? Because it sounds like your program is like a nonprofit, but if, are there some places where maybe you could have it covered by insurance?
That I cannot answer you, just because I'm not 100% sure on how they go about it. I know New Jersey is in the works to have Medicaid coverage for doula services. So that's a good thing. I know they've been working on this for a long time, and hopefully soon we get to be part of that, Medicaid reimbursement. So
Great. I can imagine.
But private insurance, I'm not sure.
Yeah,
sorry.
I'll look it up, and actually so we can provide that information for everyone.
Good, yes.
Great. So last thing, if you could provide one piece of advice, maybe about the whole process of delivery, or, if it was your sister or your niece or someone, what piece of advice from the inside would you like to give our listeners about whether it's reaching out for support or asking for help or finding resources or something to do? Can you think of something? I'm sure you have many things, but try to think of
Sure.
one.
No, I do. And I feel that everyone should be able to have a doula in their room. Just giving them that support and help, and encourage, empower them. But one of the things, trust your body, trust your, educate yourself, read about it. If you don't have that information, ask your provider. I know they will go that extra, mile and give you answer those questions. But I feel that, also your decision is very important. Is your baby, is your body, is your birth. So just make sure that, you ask all the questions, and if you're not sure about a procedure or something that is an intervention that is going to be done in that labor room, ask questions, and don't feel afraid. Like I said, it's your body, your baby, and it's your birth. So
That's amazing. I tell, you know, I feel the same way in cancer care too. I always want patients to make sure they ask the questions and feel empowered to speak up. So that's great. Well, thank you so much for your time today. This has been educational for me, and I'm sure a lot of our listeners are also may or may not have heard of what a doula is and how they can be helpful. And so I'm so happy to hear about, you know, that organizations like yours, there is good happening in the world right now. You know, 2020 has been just one terrible thing after another, and it's good to know that there are women like you out there empowering women, providing resources and connecting them with what they need. So thank you so much.
Thank you for having me. You know, it was my pleasure. And you know, I'm just happy to, you know, share my experience and share my information and knowledge, you know, that so others can benefit from this great service that doulas can bring to the birthing room. So
great. So if any of our listeners have any questions, you can email me at realwomenshealth@gmail.com and I'll pass them along to Hilda and her team. Don't forget, guys, you can also check out the podcast website on Podbean, Apple Podcasts, Alexa, and Google Podcasts. And I'm going to be posting some clips of this interview on my Instagram at Kristen Rojas MD, and also probably maybe on the Amar website as well. So thank you guys for tuning in. Thank you so much, Hilda. Again, I'm sure you're very busy taking care of all these women, so I really appreciate your time and expertise.
Thank you for having me.
Until next time, bye everyone.
Bye.